Hi, my name is Julia and I'm going to be the student nurse today. Today I am assessing Albert. Albert just told the licensed nursing assistant that he has been having increased burning and pins and needles sensations in his feet. With this in mind, I will be assessing Albert's peripheral vascular system, as the pins and needles could be a sign of poor blood flow to the feet. Before beginning the assessment, there are several cultural considerations to take into account. Many Asian cultures place emphasis on respecting those in positions of authority, and this may look like avoidance of eye contact or short, concise answers to questions asked by their healthcare team. It is important not to get discouraged by this, as this is their way of showing respect. Next, some Asian cultures have differing views on touch. Some believe that the soul lives in the head, so it is important not to touch their head unless necessary for the assessment, and to let the patient know when you will be touching them for the rest of their body. With these considerations in mind, I will begin my assessment of Albert. For the sake of time, we will not be taking Albert's vital signs. Another thing to consider when assessing this patient is the patient's developmental stage. Albert is a 95-year-old man with hearing loss and vision impairments. With this in mind, it is important to speak clearly and concisely with talking with the patient, as well as talking through what you are doing to assess the patient to make sure that the patient knows what you are doing at all times.
Come in.
Hi there, my name is Julia. I'm going to be your student nurse today. Would you be able to verify your name and date of birth for me?
Albert, 5/16/1927.
Alrighty, and then can I just check your wristband to make sure that's correct? Awesome, perfect, alrighty. And the nursing assistant told me that you were having some pain in your feet today?
Yes.
Yeah, pins and needles, I think she said?
Yes.
Yeah, when did that start?
Yesterday.
Okay. And is there anything that makes that pain better, makes it worse?
No.
Okay. And what would you rate the pain on a scale of 1 to 10?
6.
Okay. And is the pins and needles feeling just in your feet or like all over or?
Just in my feet.
Okay. And are you taking any medications to help with the pain?
No.
Okay. When do you feel the pins and needles in your feet? Is it better, worse in the morning, worse at night, just all the time?
At night.
Okay. And do you have any history of peripheral vascular disease or anything like that?
No.
No? Okay. So it sounds like you might be having a little bit of low blood flow to your feet, so I'm just going to assess the blood flow to your feet, if that's all right with you.
Okay.
Alrighty, so the first thing I want to do is I'm just going to assess the blood flow to your hands to make sure that your feet are the only place on your body experiencing any pain or pins and needles. Is that okay if I touch your hands?
Yeah.
Alrighty, so I'm just going to assess your capillary refill time. Alrighty, that one looks good. And that one looks good as well. It was about 1 second, which is normal. And your hands look like a normal color and they are normal temperature as well, so that all looks good there. So I'm going to move down to assessing your feet. So I'm just going to pull this blanket up. There we go. And is it okay if I take your socks off?
Yeah.
Alrighty. The color of your feet do look a bit pale. Is it okay if I touch your feet? Mm-hmm. Alrighty. The temperature is slightly cool as well, so maybe not as much blood flow to the feet. So I'm just going to feel for your pulse. Okay, and I'm not feeling a pulse in your foot at the moment, but I'm going to check with the Doppler first. Alrighty. Alrighty, so I'm getting a pulse there. That's good. Alrighty, and I'm just going to check down on the side of your foot as well. Alrighty, and I am getting a bit of a pulse there as well. Alrighty, Albert, so after my assessment, I believe that you might have a bit of decreased blood flow to your feet, so I would recommend maybe getting up and walking a little bit more during the day just to increase the blood flow to your feet, and if you need help, either me or one of the other nurses can walk with you as well, okay? Perfect. Next, I would want to document my results of my assessment of my patient. I would document my results as follows. I would document using the SOAP method of documentation. First, subjective. Patient is a 95-year-old man who has lived in the skilled nursing facility for the past 8 years. History of vision and hearing impairments. Objective. Patient complaining of pins and needles sensation in feet bilaterally. Rates pain 6 out of 10. Has not taken medication for pain. Hands. Skin is pink, warm, dry. Capillary refill time is less than 2 seconds bilaterally. For the feet, the skin has pallor, is cold and dry. The dorsalis pedis pulse is +1 and irregular, and the posterior tibial pulse is +1 and irregular, and all these findings are bilaterally. Assessment. Patient is receiving decreased blood flow to the lower extremities. Plan. Patient should spend more time out of bed and on feet to increase circulation, and there should be a nurse to walk around with the patient due to the patient's hearing and vision impairments.